A great report came out at the end of December by the King's Fund based on their research around new models of home care, and it's absolutely worth a read. And now that I've had my inspection by CQC and I've been a registered manager for over 15 months, I wanted to share some of my learning and what I think might be possible going forward with home care. Most of the initiatives are focusing on how can we recruit people better and tell better stories about what it's like to work in care, and also how can we increase the hourly rate. And whilst I think both of those things are important, I'd like to share 3 other ways that we can think differently about supporting people to live well at home. So the first is the service that is commissioned. Can we think differently about that? And I think that if we were together in a room with a blank piece of paper asked to design supports for people living at home, we probably wouldn't have a separate reablement service and a separate home care service, and great work done by social prescribers and prevention too. I think we'd bring them all together into one. That we'd see reablement as an ethos, not a separate service. We'd see connecting people to what's happening in the community as something that we have to make available to everybody, and we'd still be paying attention to the practical support that people need at home, but truly integrating that with health support and social care support. So in WellBeing Teams, we're really excited to have an opportunity to test out some of those ideas with colleagues in Thurrock over the next 18 months as a pilot, bringing together reablement, home care, community and prevention, and seeing what we can make happen and what the evaluation tells us after 18 months. So that's the first. Can we change the service that we offer? The second is, can we change the way that this is commissioned? And I am really inspired by the Raglan Project. Now, if you Google that, the Raglan Project, you'll be able to find lots of information on it, and it's also on the Sky website as an example of different ways of commissioning home care. And what they've done is they've taken the notion of self-managing teams, paying people a salary, paying people for shifts, having a small number of people working in a place-based way, and thinking about core tasks and flexible hours, and really creating different ways of a relationship-centred, place-based offer. Now, I think that sounds fantastic. It's been heavily evaluated. It's been shown to make savings as opposed to cost more. And I think if that could be replicated and demonstrated in other areas of the country, that would be amazing. And any commissioners out there who want to do that, WellBeing Teams will be so up for working with you that way. So the second one is, can we commission differently, away from task and time, and think about ways where we can pay people salaries and work in a relationship-based and community-based flexible way. And then the third one is looking at different ways of organising the support that we provide in partnership with other people. So I've been starting to have conversations with innovative housing organisations, housing associations, who could come together and deliver both domiciliary care to their local community that they serve, as well as support to people in housing schemes. Because one of the things that I've learned is, if you are supporting people to get up in the morning and to have lunch, everybody should be up by 11 o'clock in the morning, and nobody wants to have lunch at 11 o'clock in the morning. So there are some hours that are really difficult to use home care resources to support people, but they could be turned into community activities or different ways of supporting people in housing schemes. So seeing if we can work together to see if there are opportunities there seems like something worth trying, and I'm really pleased to be having conversations with a couple of innovative housing associations to test that. Sadly, our high streets are failing, and lots of people who have been working in retail will no longer have jobs. These are people that we could encourage and support to see if care is where they want to work and make their contribution. We will not be able to do that in the way that home care is currently resourced and commissioned. We need to be able to offer people jobs at a good salary where they're paid for a whole shift. So whatever changes we make in home care, for me, that has got to be the most fundamental one we achieve. These 3 ideas could all be ways to do that, and it is important that we increase the hourly rate, and it is important that we tell better stories about care. But we need to do something much more fundamental than those 2 things to see if we can find other ways to support people well at home. And I really want to be part of trying those out over the next year.